Gantenerumab is targeting the form of beta amyloid that is in plaques in the brain. Crenezumab is targeting the form of beta amyloid that's called oligomers. So this is a form of beta amyloid that is dissolved in the fluid that's inside the cortex of the brain. And there's been evidence for a lot of years that A-beta oligomers are the toxic form of amyloid, and that they exert a lot of negative effects on synapses and probably directly on neurons as well. And so Crenezumab is actually the leading investigational therapy that directly targets that toxic form of A-beta. And so CREAD-1 and CREAD-2 are the two phase 3 trials of Crenezumab, and those are both fully enrolled now. So the last patients are, already in those studies, and it'll take a couple of years for the double-blind portion of that study to be over and for us to get a readout. We have some exciting data that we're showing at the conference here, showing that in the CSF, there's evidence that Crenezumab is able to successfully lower oligomer levels in the CSF. I think this is one of the most exciting times to be in Alzheimer's disease therapeutic research. We're standing on the foundation of a lot of years of a lot of clinical trials that have given us really important insights into the biology of Alzheimer's disease and also into how therapies, especially therapies targeting beta amyloid, how they work. We've learned things like you have to dose high with these antibodies in order to get a therapeutic effect. We've learned that you have to target patients that are in the early stages of their illness. We call this the prodromal stages, or mild cognitive impairment stages of Alzheimer's disease, and mild dementia. So treating at a high dose and treating early are critical. And we've also learned about the really important use of biomarkers to characterize our patients, to understand how our therapies are targeting the molecular targets that they're aimed to go for in the brain. And so we're standing on this wealth of knowledge, and that has helped us to improve the design of our clinical trials to maximize the chances that we can show a benefit for patients. I still treat patients. I still treat patients in a memory clinic, and I'm tired of having to tell them we don't really have anything that can help you. And I'm really optimistic. Again, I think it's an exciting time in the field, and I'm hoping that among the therapies that are in trials now, hopefully some of them will end up succeeding, and we can change what we tell our patients.